Hello. Hello. Yeah, we can continue. Section. L1 level. L1 level. This section is cut from down upward or opposite. This section is cut from down upward or opposite. It is from below. It is from it is from below. Then identify structure number five. Structure number five is looks like this. Okay, structure number five. This section is cut from downward. See from the below. Yes, from the below, as like the previous we had in our PDF, like the same, but here little more details. Section is cut from the below. Identify the structure number. Structure number five. It is antrum of the stomach. Structure number five. Antrum of the stomach. Structure number five. This is antrum of the stomach. Structure number five. Antrum of the stomach. Structure number 15. 15. It is in the left side. It is kidney. Left kidney. Number 15. Left kidney. Can see the structure. Asma, Asma, you can see. Okay, don't sleep. You can woke up maybe. This is very late already. Day gone. Half of the day gone. You are staying another part of the world. I'm another part of the world. Now here it is. It is. I don't have clock. I'm sorry. I don't have. It is two. Two. See, they finish. They finish. After sometimes Mr. Moon will come. Sun is going to say Tata. Okay. Identify the structure number five. Structure number five is antrum of the stomach. Left kidney, number 15. Inferior vena cava. Inferior vena cava, number 25. Inferior vena cava, number 20. Okay. Number 25 is inferior vena cava. 25 inferior vena cava. Number 37. 37. 37. That is 37. 37. 36. 37. Okay. 37 is in the liver. This is 37. 37 is the right and left lobe of the liver. 37 both right and left lobe of the liver. 37 is the right lobe and 40 is the left lobe. Okay. 37 is the right lobe and 40 is the left lobe of the liver. Again, number 5 is number 5 is antrum of the stomach. Number 5 antrum of the stomach. Number 15 is the left kidney and number 25 inferior vena cava. Then number 40 is the left lobe of the liver. Number 37, right lobe of the liver. Okay. Hmm. Now, what is the space between abdominal wall and the liver? Abdominal wall and the liver is the subphrenic space. Abdominal wall and the liver subphrenic space. What is the space behind the stomach? It is leather sac. Locate gallbladder on the subject. This is surface anatomy. Locate gallbladder on the subject. So this is another surface anatomy. Okay, good. Surface anatomy at the angle between nine costal cartilage. At the angle between nine costal cartilage and lateral margin of the rectus sheath muscle. So at the angle between ninth costal cartilage and lateral margin of the rectus sheath. At the angle between ninth costal cartilage and the lateral margin of the rectus sheath. Move your finger down with costal cartilage till the anterior mid-axillary line. What organ is underneath? Liver. What organ underneath? It is the liver. Left lobe of the liver. Okay. Where does the left lobe of the where does the left lobe of the liver extend on the surface anatomy? Can extend to the left fifth intercostal space, and the mid clavicular line. Can extend the left fifth intercostal space and mid clavicular line. Can extend into left fifth intercostal space. Can extend into left fifth intercostal space in left mid clavicular line. Okay. If stabbed in the epigastric region from inferior to superior, what structure is addressed? Inferior to superior, left lobe of the liver and the stomach. Left lobe of the liver and the stomach. Then, what are the boundaries of the quadrate lobe? Quadrate lobe in the left, fissure for ligamentum teres. In the right, gallbladder. Anteriorly, anterior free margin of the liver, and posteriorly hepatis. Left, L for L, A for A, P for P, and ligamentum teres. L, ligamentum teres, fissure for ligamentum teres. Right, gallbladder. Anteriorly, anterior free margin of the liver, posteriorly porta hepatis. And now caudate lobe lower. Caudate lobe in the left, again L for L, ligamentum venosum. In the right inferior vena cava, groove for the inferior vena cava. Inferiorly, inferior hepatis, inferiorly. So inferiorly porta hepatis and inferiorly porta hepatis and superiorly bare area of the liver. Superiorly bare area of the liver. Then what structures separate right and left lobe of the liver? Um, anteriorly falciparum ligament, and posteriorly inferiorly ligamentum teres and ligamentum venosum. Fissure for ligamentum teres and ligamentum venosum, it is posteriorly inferiorly. Okay, and functionally by an imaginary line drawn from group for gallbladder and group for inferior vena cava. So this is surgical. Sorry. Okay. So this page almost done. Identify the following structure. Number 21. 21 is quadrate lobe. Quadrate lobe. 21 quadrate lobe. Number 2 is caudate lobe. Number 17 is ligamentum teres. Ligamentum teres and falciparum ligament. Ligamentum teres and falciparum ligament in the fissure for ligamentum teres. Ligamentum teres and falciparum ligament in the fissure for ligamentum teres. Number 13, inferior vena cava. Number 20. Number 20 is portal vein. Number 20, portal vein. Number 11, hepatic artery. Number 11, hepatic artery. Number 5, common hepatic duct. Number 5, common hepatic duct. Any one of you can repeat it rapidly. Number 21, number 2, number 17, ligamentum teres and falciparum ligament in the fissure for ligamentum teres. 13, inferior vena cava. 20, 20, and number 20, 11, and 5. Common hepatic duct. Okay. Okay. Identify identify structure number two. Structure number two is it is calciferum ligament. What does it connect to? Calciferum ligament connects liver with the diaphragm. What is it is made up of? Two layer of peritoneum fold closely two layers of peritoneum fold closely unite together. Two layer of peritoneal fold. Two layer of peritoneal fold closely unite together. What is composed of? It is two layer of peritoneal fold. It is composed of two layer of peritoneal fold. Okay. It is two layer of peritoneal fold closely joined together. Hmm. What does it contain? It contains round ligament and perumbilical. It contains round ligament and perumbilical vein. Round ligament and perumbilical vein. Round ligament and perumbilical vein. The falciparum ligament, it contains round ligament. Falciparum ligament contains round ligament and perumbilical vein. Blood supply of the quadrate lobe. Quadrate lobe, quadrate lobe blood supply is just it is near the portal hepatic. So it is from right hepatic artery and portal vein. Right hepatic artery, quadrate lobe. Quadrate lobe gets blood supply from right hepatic artery, from right hepatic artery and portal vein. What are the attachment of the liver to the diaphragm? Liver to the diaphragm, liver to the diaphragm, liver to the diaphragm, liver to the diaphragm. Okay. Liver, we have falciparum ligament, right and left triangular ligament, falciparum ligament, right and left triangular ligament, upper and lower coronary ligament. Falciparum ligament, right and left triangular ligament, upper and lower coronary ligament. And it contains falciparum ligament, it contains round ligament and para-umbilical vein, round ligament and para-umbilical vein, round ligament and para-umbilical vein, round ligament and para-umbilical vein. Now, what are the attachment of the diaphragm? Sternal, sternal part, Gifford process of the sternum, costal part, inner surface of the lower six costal cartilage, inner surface of lower six costal cartilage, vertebral part, right crura number 1 to 3, left crura number 1 to median sacral, median arcuate ligament between two crura, medial arcuate ligament, then lateral arcuate ligament. Just this name. So vertebral part, right crura number 1 to 3, left crura number 1 and 2, then median arcuate ligament, medial arcuate ligament, lateral arcuate ligament. Lateral tip of the transverse process to number 1. Okay. Now, opening of the diaphragm. Diaphragm has vena cava opening, esophageal opening, and aortic opening. Vena cava opening, vena cava opening, VOA. It is 8, 10, 12. VOA. Vena cava opening, esophageal opening, and aortic opening. Vena cava opening T8. T8 vertebral level vena cava, esophageal opening T10 and aortic opening T12. T12 aortic opening. Structure passing through the central tendon. Structure passing through the central tendon, inferior vena cava and right phrenic nerve. Structure passing through the structure passing through the central tendon. Structure passing through the central tendon, that is inferior vena cava with right phrenic nerve. On patient show the anterior, mid, and posterior axillary line. On the patient, show anterior, mid, and posterior axillary line. So anterior axillary line need to show. Is it just need to show or have to say the anatomical marking landmark? Anterior axillary line, mid axillary line, posterior axillary line. On the patient, show anterior axillary line, mid axillary line, posterior axillary line. But how they decide? Asma, you have idea how this one? Yes, surface anatomy, but how we will hmm? Mm-hmm. Mm-hmm. You know the answer? Uh, Krishna, do you have any idea? This one? Mm, this one, then we have to anterior axillary line, mid axillary line, and posterior axillary line. This one we need. We need to know this one. Surface anatomy of anterior, mid, and you have the anterior axillary line marking the anterior axillary fold, the mid axillary line situated between the anterior and posterior axillary line, and the posterior axillary line marking the posterior axillary fold. But a little more. What is the anterior axillary line surface marking? The anterior axillary line is a coronal line on the anterior dorsal marked by the anterior axillary fold. Anterior axillary fold, you got anterior axillary line. A vertical line that runs down from the anterior axillary fold, which is formed by the yes, good, very good. Yes, this one. Yes, okay. Okay, so anterior axillary line locate a vertical line that runs down from the anterior axillary fold, which is formed by the pectoralis major muscle. The surface marking, if you run your arm slightly, okay, again you can repeat anterior axillary line, a vertical line that runs down from the anterior axillary fold, which is formed by the pectoralis major muscle. Or how you will say, can you repeat again? Anterior axillary line. Hmm, good. It is easy. Anterior axillary line is a vertical line that runs down from the anterior axillary fold, which is formed by the pectoralis major muscle. Mid-axillary line is a vertical line that runs straight down apex of the axilla, from the apex of the axilla, and posterior axillary line is a vertical line descending from the posterior axillary fold, which is formed by the latissimus dorsi and teres major muscle. Latissimus dorsi, teres major, and latissimus dorsi. Okay, okay. One second. This is anterior axillary line, mid axillary line, and posterior axillary line. Anterior axillary line is a vertical line that runs down from the anterior axillary fold, which is formed by the pectoralis major, maybe lateral border, I don't know. Mid axillary line is a vertical line which is uh, uh, drawn vertically downwards from the apex of the axilla. And posterior axillary line is a vertical line which descends from the posterior axillary fold, formed by latissimus dorsi and teres major muscle. Okay, that's why you are sleeping. Hmm? You are silly. You are sleeping. Okay, so this is the anterior axillary line, mid axillary line, and posterior axillary line. Anterior axillary line is a vertical line which runs downwards straightly from the anterior axillary fold, which is formed by the pectoralis major muscle. Mid axillary line is a vertical line which is drawn from the apex of the axilla, which goes vertically downwards. And posterior axillary line is a vertical line which goes vertically downwards, made by latissimus dorsi and teres major. Latissimus dorsi and teres major. Okay. Okay. Again, we have surface anatomy of the liver and demonstrate on the patient. Surface anatomy of the liver. Okay. Upper border of the upper border of the liver. In recall, we have seen this one coming many times. Upper border, the upper border and lower border. So upper border. Asma, you have idea how to do it? Upper border of the liver. Hello. Upper border is upper border. It will be like point on the left fifth intercostal space. Point in the left fifth intercostal space. That will be like the apex. Okay, left fifth intercostal space at the left lateral vertical plane. Okay, left fifth intercostal space. Then point at the GPO-sternal junction. Point at the GPO-sternal junction. A point. First point. The left fifth intercostal space at the left lateral vertical plane. At the left lateral vertical. Okay. Left lateral vertical plane. This is the first point. Fifth intercostal space and left lateral vertical plane. Second point at the junction of the GPO sternum and point on the right fifth rib on the right lateral vertical plane. So one is left lateral vertical plane, one is right lateral vertical plane. Okay, left lateral vertical plane, left lateral vertical plane, and one is right lateral vertical plane. So now it is easy. A point here will be one left lateral vertical plane and right side also one right lateral vertical plane. So first point on the left fifth intercostal space uh, at the left lateral vertical plane, and then second point at the GPO-sternal junction, and third point in the right fifth intercostal right fifth rib on the right lateral vertical plane. The point on the seventh rib in the mid axillary line. The point on the seventh rib in the mid axillary line. The point in the seventh rib in the mid axillary line. Okay, so 4 point. 1, 2, 3, and 4. Again, first point on the left fifth intercostal space, lateral to left lateral vertical plane. Left fifth intercostal space at the left lateral vertical plane. Second point at the junction of the GPO-sternum. Third point uh, at the right fifth rib, little high, right fifth rib at the right lateral vertical plane. And fourth point, and the seventh intercostal space, the right seventh rib, right side on rib, right seventh rib, right seventh rib in the mid axillary line. Okay, this is the upper border. Then lower border. Okay, lower border. How? Lower border is marked by the joining the following point. A point on the left fifth intercostal space in the left lateral vertical plane, same as the point 1. So for the upper border and lower border, first point is same because from this same point they will come. So same. The point on the left fifth intercostal space in the left lateral vertical plane. This is the lower border first point. Second point, point on the left coastal margin at the tip of the eighth coastal cartilage. So second point coming at the eighth coastal cartilage. Eighth coastal cartilage. Second point on the left Second point is hmm? Now. Okay, is that time coming? Hmm. Here or no? Okay, okay, I'm coming. Coming. Okay. Not but okay. A point where lift fifth intercostal space in the left lateral vertical plane point on the left coastal margin at the tip of the tip of the coastal cartilage and tip of the eight coastal cartilage. Okay, left coastal margin at the tip of the eight coastal cartilage and a point at the transpyloric plane in the midplane. Then fourth point is transpyloric plane. Fourth point is transpyloric plane. Yes, now this is third point. This is transpyloric plane. Third point is point at the transpyloric plane in the midline. Okay, transpyloric plane in the midline. Sorry, it should be in the midline. Transpyloric plane in the midline. Transpyloric plane in the midline. Third point is transpyloric plane in the midline. And 1 centimeter, 1 centimeter below coastal margin in the right lateral vertical and right mid-axillary line. Lower border. How to do lower border? Lower border. 1 centimeter below coastal margin. 1 centimeter below the coastal margin. Okay. 1 centimeter below the coastal margin in the right lateral right lateral vertical and right mid-axillary line. This one I think better. Right mid-axillary line. Okay. 1 point below, 1 point below the coastal margin, 1 point below the coastal margin in right mid-axillary line. Yes, mid-axillary line, coastal margin when finished, from there 1 centimeter below is the mid a point 1 centimeter below the coastal margin in the right mid-axillary line. Aspa, you studied this one in this way or another way? Surface marking? Uh, Now it is surface marking coming. Today I kept, I was planning to do all the surface marking. So liver, spleen, and kidney, these three, uh, actually I didn't do properly last time. So upper border, it is okay. Upper border by four point. First point in the left fifth intercostal space at the left lateral vertical plane. Left lateral vertical plane. Yes, here will be left lateral vertical plane. Here will be a vertical plane, and this side also will be a vertical plane. So first point will be on the left fifth intercostal space, left 1 point, left fifth intercostal space at the left lateral vertical plane. Left lateral vertical plane. Then second point at the junction or at the GPO-sternal junction. Third point in the right fifth rib, mid-clavicular line. If it is mid-clavicular, then life will be easy. Can you check? Left lateral vertical plane and mid clavicular line is same or not? You're right. Okay. Then instead of left lateral vertical plane, this is difficult to say. We can say mid clavicular line. Okay. So we can say the first point in the left fifth intercostal space in mid clavicular line, easy. Second point in the GPO sternum. Third point in the right fifth rib at mid clavicular line. Fourth point mid uh, axillary line. Is it mid axillary? Yes. At the seventh rib. Seventh rib in mid axillary line. Mid axillary line, you can draw here like mid axillary line. Yes, mid axillary line, seventh rib, upper border finish, easy. Then lower border, first point in the left fifth intercostal space, mid clavicular line. Second point at the mid line at transpyloric plane level, that will be at lumbar one. Fourth point, sorry, third point will be left fifth intercostal. Okay, this one, particle is mid mid clavicular line. Okay, so left costal margin at the left costal margin at the tip of the eighth costal cartilage. Okay, in between there is a, this is tip of the eighth costal cartilage. Second point, and third point at the transpyloric plane in the midline. This is third, and fourth, 1 centimeter below the costal margin, 1 centimeter below the costal margin into right mid axillary line. 1 centimeter below the costal margin in the right mid axillary line. Okay. Then this is the inferior border. And right border presented by a straight line convex on the right joining 2 points. Point on the right seventh rib at the mid axillary line and pointing the right 11th rib at the mid axillary line. Okay. This is the right border. Okay. I will keep this one going. Hmm? It is written where? Uh, I don't remember that there. But now it is okay. Now I think at least liver and before liver what we studied this anterolateral line, mid posterior, these two downwards. It is written left lobe. I think it should be right lobe. Yes, because it will be in the left side. Hmm. Yes, yes, yes. I also thought. Hmm. Right lobe. Hmm. Okay, actually. I'm staying in guest house now. Now here it is almost 2. To they prepare lunch. I need to go maybe for 10 minutes. I will keep it running. You can you can have a look, and once I join, then I will again rapidly go. Okay. You and Esra, you both can continue. I will join. I will come quickly.